lot of times people who are on opiates or alcohol, a lot of your receptors are down-regulated because you're just dependent on this drug and medication. So one of the way I describe NAD is it's basically like a power wash for your cells and organs. That's why a lot of people feel like a zombie. You have to actually clean the cells so the brain can function properly.
Is it true that the NRIV will boost your NAD levels more than NAD itself?
I don't know whether it's true or not true. I think it's...
Meet Dr. Halland Chen, a double board certified physician known as the Longevity Doctor and featured in Forbes, HBO, and Elle.
As a leader in regenerative medicine and NAD plus innovation, he's shaping the future of human performance and healthy aging.
What else are you treating with NAD?
The reason why we age is due to inflammation. NAD is fundamental for just decreasing inflammation in the body. So when we think about how NAD works in the body, it's really about...
What is it that NAD's doing in the body that's making people sharp as a tack?
People who are depleted of energy, they probably have that fog lift when the NAD gets into their brain. From a cognitive standpoint, NADH is more effective for clearing out that fogginess and giving people that mental sharpness.
Why are people going to Mexico to go get these stem cell procedures?
There's many reasons. One, it might be cost. The FDA regulates the stem cell like a drug. If a stem cell can heal your torn meniscus, that's a therapeutic benefit. The second aspect is when you think about...
Is there any patient that shouldn't get NAD?
I think that's a tough question.
Welcome to another episode of a Healthy Point of View podcast. I'm your host, Sam Tejada. And as usual, we're bringing experts from all over the world to talk about health, wellness, beauty, and mindset. Today's guest, this guy, you guys have seen him, HBO, Forbes, on all of the main stages in the longevity space. He's an expert, a guru behind NAD. He talks about NR, and he also is on the research side with a lot of the stem cell products that are out there. We're going to get into a lot of that. Here in Florida, July 1st, some new things just happened when it comes to stem cell. And we're going to talk a little bit about that so you guys can kind of understand what's happening in the world of regenerative medicine. Today, we have Dr. Halland Chen. Doc, hey. All right, man. Pleasure to have you here on a Healthy Point of View podcast.
Thank you for having me, Sam. Much appreciated.
Absolutely.
I've known you for quite a long time. Love the Liquid Vita brand and the things that you guys do, and it's just so great to see what you're doing and grow as basically people are more into functional medicine.
Absolutely.
And I think what you guys do is great on the functional medicine cornerstone. So really nice to be here.
Thank you, man. It's amazing how, with the power of social media, we have the ability to follow each other's journeys, right? Throughout this longevity space. I'm doing one thing, you're doing another thing. We bump into each other at some of these longevity events and, meet a bunch of other great people that are out there. So, I want to take a few minutes here for the listeners and viewers to understand who Dr. Halland truly is and how the heck did you get into the longevity space?
Sure. So my background is I went to medical school, traditionally trained, did my original residency in PM&R, so it stands for physical medicine rehab. So we deal with all kind of pretty complex stuff: spinal cord injury, traumatic brain injury, stroke. I then did a fellowship in an interventional spine in New York City. And so that brought me into the more complex world of pain management, where we're doing intrathecal pumps, spinal cord stimulators, and then typical things like epidurals. And at the end of all that, I realized I don't think we're actually healing anybody. It was kind of putting a Band-Aid on the solution. And so, back then, that's quite a number of years ago, I was like, there's got to be a way to actually heal the body. And so that's kind of when a large part of my research was more into the regenerative medicine side. So this is back in 2010. So
Wow.
15 years ago, talking about stem cells was not even very popular. Even nowadays, some people think stem cells are like maybe stem cells from a fetus or embryo. That's very, very old school. I mean, I think a large enough group now know that that's really kind of out of favor. And most of the stem cells that people think about are, umbilical cord or mesenchymal derived. We can get into that later. But, a big part of my philosophy is like, how do I help the body heal? How do I help people naturally progress in ways to stay younger or reduce inflammation in their body? And so I've been doing that journey since basically the last 15 years.
Wow.
And then now we're doing a lot of research in the NAD world. NAD has always been a very popular thing recently. We've been really heavy in the NAD space for about the last 10 years, so since 2015. And now if we really focus on metabolism, how does NAD promote your health? How does it help with anti-aging, longevity? So it's a pretty big topic that still has a lot to be elucidated, which is why we're really hard in the space.
Absolutely. So, you're talking about how you're doing all these other procedures, but you felt like you really weren't healing the patient per se. Um, how frustrating was that?
I think it's kind of one of those things where it's a little bit of an insurance game, unfortunately. Some patients might need a procedure, but they can't. It gets denied. Some people might need this, but that's what they didn't want. That's what the protocol is. So kind of there's a discrepancy of what you learn in med school and then what happens on a procedure perspective, right? And
Right.
sometimes, look, the insurance companies are there for a reason, and it's not like all insurance is bad, but there's a bit of a gap between what's needed and then what actually happens in real life. And so it's a
Right.
lot of administrative and paperwork. So it was quite frustrating. I think medicine in general is a very frustrating experience, especially when you're very sick. People feel like the system doesn't work. They feel that maybe their healthcare provider is not in touch with their needs. The way things are driven now, it's always about, speed and quantity versus depth and quality. So I think just the way we structured our practice, we're pretty fortunate we can do more of a boutique concierge medicine. And so we really kind of focus on particularly specific stuff, right? A lot of it could be very much peak performance, and then every now and then we have some very complicated cases that we know how to solve as well.
Yeah, absolutely. So, we have a lot of physicians that tune in. We have a network of over 4,000 doctors that buy our Liquivita products. And one of the things that I try to put a lot of emphasis on is that learning never stops.
Mhm.
And it seems like learning doesn't stop for you.
No, I think you're always a student of life, right? But
Right.
I think part of my personality is always to like ask questions and wonder why. So I always like to say I'm on the client side, meaning like if you're thinking it, I'm probably thinking it too. Right. And so especially with some of the newer stuff that we're doing, they're like, have you ever tried that? Or they're asking about it. It's like I probably tried it on my own body because I already have a pretty high resilience. So I can do high doses on myself, try new things and
Mm,
see if it works. And so I'm always patient first. I'm always their advocate. I think that's what they really want, especially when you're dealing with complicated cases, because a lot of again, like I say, the system or however you want to call it, isn't always proactive in finding solutions. So I think that's also that natural curiosity is one of the reasons why I went back to more of a university setting where we're going to be doing some pretty incredible studies, university based collaborations with companies who can then also do research at the university. So I think that was one of the biggest drives of what really brought me back to Miami, other than the fact that I trained here and went to school here as well.
right, right. That's the Miller School of
Yep.
Medicine, right?
Yeah, University of
So,
Miami Miller
right.
School of Medicine.
So, you know, you're obviously really big into data. You're wearing the Oura ring, right?
Mhm.
And you're physically fit. You take care of yourself. So how important are those things when it comes to overall health? Because it seems like you're making that a priority.
Yeah, I think it's really hard to have some sort of measurable outcome without tracking it, right? So
Right.
I wear Oura Ring as a sleep tracker. I've done all the different other wearables too, like Whoop and Fitbit. Sometimes it's a little overwhelming because you have so much data to wear or to
Yeah.
manage. So I try to keep it a little bit more simple. I think the biggest thing is like even with lab testing too, right? Like you can have your typical labs, which you might get your primary care doctor, but there's a lot more advanced labs now. And I would say with the advent of ChatGPT and AI, people are getting so much more, insight into what could be tested. Testing their microbiome, they're testing their hormones because not everything that you might do at your endocrinologist might cover some of the symptoms you have, right?
Right.
And so we've seen a lot of that. So I think number one, like data first, right? Or at least data centric, or at least something based around that's something that's measurable or even if it's just symptom tracking, right? That's still data
Right.
because we may not have a quote unquote longevity test. You may have markers towards it. But if you're overall feeling better, more energetic, feeling more positive than negative on days, like these are all things that kind of build that whole picture. And I think that's where the longevity space will go is that as a field, one day I hope it becomes like a formal training program from medical school or residency is what we call it. And I think it's going to be very heavily data driven because the aspect of longevity is the absence of disease. But medicine, ironically, is the study of disease. So
Mm,
you're really in a field like, a lot of myself and functional medicine people, we're in a space that's the absence of the disease. So we're really talking about what is the presence of health. And so the only way to understand presence of health is actually having data or some sort of signaling that gives us this information.
right. Right. I agree with that, man. But at the same time, like some people will go a little bit too crazy with it,
Yeah.
where all of a sudden you start to become stressful from just following your health process, where it's just like you're looking at the data way too much. You're wearing like five different wearables, you're doing blood work a little bit way too frequently. So what's your recommendation for the person who's like going a little bit more than above and beyond.
Right. I think it's really about what suits your lifestyle, right? Because like even for us with clients we work, I say there's, first things first, there's no judgment. Like everyone has their things that they like to do, and some of these habits may help their longevity, some may hurt. Let's take the
Right.
easy stuff. Uh, Being in Miami, a lot of people are night owls, right? And but technically getting good amount of sleep is something that you want to, put value
Right.
on for longevity. Some people like to drink a lot, right? So I don't have a judgment against it. I'm sort of like, okay, if you do this, we're going to undo it with this, right? If you are a heavy drinker or stay late at night, or stay late at night, you can do NAD. IV NADs help reset that circadian rhythm. They help detox the liver, things like that. And so I think for people who kind of overdo it, they have to kind of come with like one or two simple goals that they want to optimize. And once that becomes this muscle memory thing, or you're in a steady state, then tackle number three and four. I think a
Right.
lot of people get into this whole wellness kick and they try to do 20 things, and they can only eat at certain times, and they don't want to stay up past late. There's that whole effect where it's actually also unhealthy because you're not really living your life. So
Sounds like that don't die guy.
yeah, a little bit like
You know who we're
that.
talking about.
Yeah,
Mr. Brian Johnson. He's
yeah,
I love following his journey. I won't do what he's doing,
yeah.
me personally, but it's interesting what he's going through.
I think it's an interesting case study, right?
Yeah.
Because in his protocols, I think there's a lot of interesting things in it. Now, there may be takeaways, is what I say for some people. You can take away this. You can just take away the best parts that work
Right.
for you.
Yeah.
Because again, the idea is not to like have this consume your life. The idea is like, okay, let me make this better. And so I typically when we work with people also we say there's like one thing that most people want to focus and work on. And so pick that one thing. It's kind of like setting a goal. Let's say most people for New Year's, they want to lose weight, they want to do this, they want like pick one or two. And the same thing for your health. If your health is like, I'm sedentary, well, then start walking more.
Right.
But then people are like, well, I want to be like competition fitness level. That's just not as practical.
Yeah.
So
Right.
yeah, I think it comes down to like really getting clear with your goals and focus, which is like a lot of life, but applying that into your health life as well.
I agree. I agree. So, Doc, NAD. You're the expert in the field of NAD. Like anyone I talk to, they bring up your name, right? Why did you go to become such a guru behind the NAD, you know, medication or drug or
Yeah,
nutrients,
but
whatever we want
it's
to
I
call it?
kind of like, it's that interesting realm. It's like, is it a nutraceutical? Is it drug? I mean, it's basically a coenzyme, just as a pure definition of what the molecule is. I got really into the NAD space because ironically, through my stem cell work, I was like, okay, what can give the body more energy for the cells? And it was NAD. So it actually came more of a byproduct as we were studying stem cells.
Mm,
And we've been in the stem cell space since 2010. So studying how hematopoietic stem cells from bone marrow work, how do stem cells work from derived from adipose tissue? What were exosomes? So we were very early in this space, and ironically, now it's fast forward 15 years later. Maybe we were lucky. I happened to choose a field that I thought had a lot of potential. I didn't think it would grow so much in as what we are now, but we're doing studies that have FDA protocols. So a lot of our research is so that we're very compliant, right? It's very important to do things in compliance with what the FDA wants when you're doing things that are pretty cutting edge. Number two, and when you do it that way, you can then scale it, and these can actually be treatments that hopefully one day, yes, do get covered by insurance,
right.
or at least can be offered by people who are just wanting to learn how to do it. And so I think the field of medicine will change drastically in 5 years, definitely in 10 years. In
Yeah.
10 years, I think a lot of the things being done now might be considered like old
Right.
school. But in terms of the NAD question, it really became a metabolism thing for me, right? And NAD being a very hard molecule to study or even characterize, when you get into this space, there's a lot of people who are like, well, NAD is the powerhouse of the cell. Your mitochondria relies on it. That's kind of like what we learned in biology 101. But the complexities of NAD, whether you give it IV, whether you give it orally, whether you do it subQ, whether you do a supplement, they all work together, right? And there's not one answer over another. So I think when you see a lot of the people talking about, oh, I would only do oral over IV. IV makes me feel upset, like my stomach upset. That's kind of just coming from a place because they probably don't treat patients, right? I would
Mm,
say when you're actually in the clinical space, it's a lot different, right? It's a lot easy to talk about, what you read on Google or what ChatGPT gives you as an answer or what you might see on YouTube, TikTok, Instagram. But then it's different when you're like treating hundreds and hundreds of patients and this is the pattern. And
right.
so a large part of what we do in the NED world now is formalizing the science, doing university-based studies, doing metabolism studies, finding out where does it go, and then finding a space where like is one thing better for another, right? You might have IV NAD. We already know IV NAD is amazing for detox. I mean, one of the people who I learned under was that they were hard in the detox space. So, meaning they did alcohol abuse, people hooked on opiates, things like benzos, NAD IV, incredible molecule to detox all of
Yeah.
that, right?
That's actually the first time I got exposed to it. What wasn't about like the brain reboot
No,
or anything. It was specifically for that. And there were aggressive dosages that it would go up to. What is that NAD doing for the patients that are detoxing off of some of these,
right.
drugs?
I think it's kind of twofold, right? And it kind of ties into like why is oral NAD important? We'll kind of get into that. And so when you kind of look at how the NAD space worked, right? A lot of times people who are on opiates or alcohol, a lot of your receptors are down regulated
Mm,
because you're just kind of dependent on this drug and medication, right? And it wasn't even on purpose, right? Nobody wants to be hooked on opiates and on these high doses where you then need to be switched on to methadone or
right.
Suboxone. And so one of the way I describe NAD is it's basically like a power wash for your cells and organs. It power washes the liver, the kidneys, clears up the receptors because all these downregulated receptors, that's why a lot of people feel like a zombie, right? When they're kind of like considered like an alcoholic or you're kind of addicted to opiates, you have to actually clean the cells so the brain can function properly. And
Mm,
so that's kind of how IV NAD works. It does a lot more complicated things because when you're thinking about how NAD in the body is, it's a fundamental molecule that goes into every cell or is utilized by every cell, like the mitochondria. And there's this whole debate about extracellular NAD, intracellular NAD, which we can touch upon later. But IV NAD is extracellular, but there are interesting lines of research where they say it gets metabolized and goes intracellularly. Now, when we think about intracellular NAD, that's when you do the precursors like NR,
okay.
like something like True Niagen. They have an amazing NR product. You have NMN, which is the more common one that people also know about. NMN is also a precursor and can go into the cell. And so these precursors are very well known because they can raise intracellular NAD levels, right? And these are things that you can measure. And so one will say, well, what's better? I want the one that raises my levels, but then I want one that might like power wash my body. I think you need both, right? Because you can't detox somebody off of alcohol and opiates just off of a precursor supplement.
Right,
It's
right.
not the same thing. But then when you're giving someone IV NAD and someone can literally get off of something like Suboxone, which is pretty much impossible by most traditional cases. So it must be doing something. And so that's a large area of our research is that how does this metabolism work, right? And so part one is to measure the metabolites and see what functions improve in the body. And then part of it's actually just figuring out what's the therapeutic protocol, right? And so
Right,
we're literally that it's like NAD has been around in the space for a long time, but it's still not a lot of human studies,
right.
right? There are a lot of animal models and sometimes, in vitro models, but my particular focus is on human clinical trials because I'm a clinician, I see patients, I've been doing that my entire medical career. And so I've always have a bit of a hybrid of like, well, now we're on the research side, we're on the research and develop innovation side, looking for new molecules, new things that can help the body. And then now on the clinical side, so that's a little bit why, in practice, we're focusing more on boutique concierge medicine because most of my bandwidth is now really trying to help teach and educate others and focusing on the research.
Right, right. So when it comes to, let's say, cognitive health,
Mm.
right? And you're talking about the precursors, like NR, NMN, and versus the NAD that's done either subcutaneous or IM or IV. How would that all come together? Would you utilize all three of those as well?
I think this is going to be the realm of personalized medicine. Maybe some people might respond better to an IV NAD. Like tons of people, when they take IV NAD, get clarity. But then I have people who tell me, you know what, it's not as convenient. I feel a little bit nauseous and sick, and they prefer oral. Some people are more into the peptide space, so they're used to injectables, so they do an injectable, right? And so I think it really comes down to what's best for the patient. And then it will also come down to is that we're going to probably start figuring out what protocols work better for certain people. I think very clearly IV NAD is a very good detox molecule. It's a very good molecule for also reducing inflammation and circadian rhythm. There's a new version called IV NR, which is made by True Niagen also,
Right,
right? So the Niagen guys have an NR IV, and that's pretty incredible because instead of doing a 3 hour NAD drip, you're going to get a drip in the same dose in 45 minutes.
right.
So that's going to have some profound effects too, which we're going to start finding out because that's pretty new in the space, right? Niagen IV, as NR is pretty brand new. So we're going to see some huge therapeutic windows and things that are probably great for brain health, longevity, functional medicine, all that type of stuff.
Yeah, they're actually speaking at our Vibe conference, our Vitamin
Okay.
Infusion Business Expo, and there's a big push behind the NR product. So, all right, so now that you brought that up, how does that compare regular NAD versus NR? Because you're talking about two whole different molecules, right?
Yeah. I think what we're going to see is that whole debate of extracellular NAD versus intracellular,
Okay,
because NR was always considered an oral precursor, right? You take it as an oral supplement.
right,
NMN was the other popular one. And then we knew it went into the cell. Whereas IV NAD typically didn't get into the cell, large molecule, positively charged, right? That's why it's often referred to as NAD plus,
right,
right? So when we talk about NAD casually, most people are referring to NAD plus, but there's other forms of NAD, right? There's NADH, it has a
right.
hydrogen ion. That's been studied, quite a long time ago. It's not as popular now, but NADH is very interesting to trend and watch because NADH is known to improve cognitive levels as well.
Yeah, so I'm smiling because when I first got into the functional medicine
Hmm.
space, and this is, I've been almost 2 decades into it. We used to do an injection that had AMP
Hmm.
and NADH,
Oh wow.
and it was like the energy shot, is what they
Yeah,
would
yeah.
call
I wish they still.
it.
It's very hard to find
Yeah.
NADH as an injectable. Really hard.
This was, Central Drugs back in the day
Yeah,
used to
yeah. No,
make it.
that's what I'm saying. 20 years ago sounds about the right time frame because
Yeah,
I really did a lot of research. I mean, even flying to different parts of the country, not even this country, around the world, finding out where was the origin of NADH and who was doing some of the early clinical work. So
wow.
it's a lot of our research is going to come into the mainstream pretty soon because NAD plus, NADH, IVNR, which is a big, I think, revolution that you can take it now by IV. So I think we're going to see different metabolic profiles based on this. And that's why the sensitivity and specificity of what we're testing, what we're measuring is going to be very important.
Nice, nice. So, I'm really big into cognitive health, and I do all
Mhm.
kinds of different things myself. I do everything from Dave Asprey's brain octane oil that he came out with Bulletproof. I do a nasal spray. I'm not sure if you've heard
Mhm.
of it. It's called a Synapsins nasal spray,
Mhm.
and it has the RG3, the methyl B12, and then it has NR. What do you think is happening in my brain when I take that Synapsins nasal spray that has the NR in it, but also the RG3 and methyl B12?
Yeah, it's probably like it's like what people simply would say it's fuel for your brain. And so you're by doing it, as a spray, you're kind of hitting that what we call cribriform plate, right? That cribriform plate is that very thin piece of, that bony area that has a thin mucus. And so because it's so thin, people will actually administer medications there in hopes to get in the brain. So a lot of people who have traveled to other countries and they wanted to do quote unquote like a stem cell therapy for the brain, they're injecting it up the nose with the hopes that it's going against this cribriform plate
Oh wow.
and absorbing it. So that's probably the mechanism of why it's going there. Whether or not it might be easier just to do an IV and then the IV gets to your brain directly. That would be interesting too, right?
Yeah. I mean,
Um,
everything, like when I do it every morning, everything's like in high definition. I hear better, see better,
mhm.
speak better. Everything's just like on point.
Yeah, no, I believe
Yeah.
that.
Yeah.
Yeah, I mean, look, it's kind of like that limitless pill, right?
Yeah.
In a spray.
Right. So with NAD, people tend to get this certain flush feeling.
Hmm.
What is that they're experiencing? And I'll tell you, like when I do my NAD subQ, I
Hmm.
typically do like 100 IU subQ, 100 milligrams. When I feel that flush, even though it's not really comfortable, I'm like, man, it's working. So
Yeah,
I'm like happy that I'm
yeah.
feeling it. I don't know if that's a good thing or a bad
I
thing.
think people want to know that it's working, right? I think the other big thing is like it's a function of speed and dose. So a lot of times when people are like, oh, I don't like NAD, I feel very uncomfortable. I mean, it's kind of naturally going to make you uncomfortable if it goes too fast.
Right.
Most people will feel heart palpitations. Some people will feel their stomach have this prokinetic, meaning like this moving. But that would make sense, right? So when you actually detox somebody who's been on opiates for a long time, one of the biggest symptoms or side effects of opiates is constipation. Guess what? When you start detoxing and several days in, their bowel function removes and or it gets restored, and so they're no longer constipated. So I think it's a combination of things that are happening. Typically, it's one of the things that I think we've really also brought to market that I don't see a lot of people do, or at least very rarely, IV NAD on a pump. The second you can actually pump it and titrate it to a very slow rate, you're not going to feel it. And so while people will say I can do NAD in 2 hours or less, or etc., I don't think it's the speed that's like meaning like it's not about how fast you get it in, it's how comfortably you do it, right? And so if you were to take something that takes you 2 hours and just double it, do a 4 hour drip, it's not going to affect you as much because one of the reasons why people don't like to do IV NAD, like they don't want to be at the doctor office for 4 hours. It's
Yeah.
like very inconvenient, right? But if you have a pump, this is obviously more like concierge style. But look, if someone were to have an IV NAD pump and they have it at their office, they could just do their normal workday. Yeah, it's a 5 hour drip. It's gotta be, like, one of those things that, like, I think we are in an era of very concierge medicine, right? That all came after COVID.
Right.
The idea of house calls, and that kinda restored a little bit of this more no one's going to the office as much, people want the services coming to the home. I think when you can do NAD IV would be a really nice use case scenario of doing a pump for 4 or 5 hours. But if you can't do that, I think that's where the use case of IVNR comes into play, right? Don't have 5 hours. Don't, this whole idea of someone coming to your office is impractical or, it's cost prohibitive, many reasons, right? Okay, IVNR, get a lot of the benefits. Does it work exactly like IVNED? We're going to find out, right? I think that's kind of part of also the research we're going to do. Let's explore because everyone also might not need to detox of opiates or alcohol or et cetera. And then look, I use the detox as just an easy thing. NAD, plus IV NAD does way more than just that. It's a
Right.
very big metabolic regulator, right? And so when you think about right, your metabolism, glucose, energy, sleep, even maybe testosterone production, right? Because if you're having better sleep, you have better testosterone production, endocrine disruption. We have so many things where I think NAD is really cross-disciplinary, so I think once people kind of understand the dose and sort of the delivery mechanisms, then it will make a lot more sense.
Right. Is it true that the NRIV will boost your NAD levels more than NAD itself?
I don't know whether it's true or not true. I think it's more, can they synergize? I think they're probably attacking the problem, or let's say low energy from different ends of the spectrum, right? Because IVNR is going into the cell. IVNAD is outside the cell, right? High extracellular plasma concentrations, but it's doing all these other chemical reactions,
Mm,
right? And so I kind of compare it to as a power. If we take your home, you kind of power wash the driveway. You wouldn't do that inside the house, but inside the house, you would actually clean it and be
right.
more delicate. So I think they work hand in hand in terms of like how to optimize the body and the cell.
Yeah, I like that analogy, by the way. That's a good one. I'm gonna use it. I'm gonna steal it from you.
Yeah,
I'll give
yeah,
you credit. Don't worry.
yeah, yeah.
um, so with NAD, what else are you treating with NAD? We talk about
Hmm.
opiate detoxification. We're talking about cognitive health. What else are people utilizing NAD for?
I think NAD is fundamental for just decreasing inflammation in the body, right? And it's very funny. Like if someone's new to NAD, meaning they haven't had it before, I call it my truth serum. So you give
Mm,
someone NAD, and they're like, "Oh, my jaw hurts," or they're like, "Oh, I have this pain around my abdomen." I'm like, "Oh, did you ever have dental surgery?" Or I'll say, "Oh, is there ever something you have going on with your ovaries or uterus?" Almost instantly, like, "Oh yeah, I had surgery there," or "Yes, I have this like tooth that needs to get drilled." So it's very interesting and and then this is obviously anecdotal, but it's not uncommon for me to kind of see what I call it does unmasking. So a lot of times if someone has something that they really hadn't thought about as a priority, it kind of localizes to that area.
really?
So that's
Wow.
kind of why I always feel like it was a little bit of an inflammation marker. Again, no clinical study on this. This is what I've just seen over the last
So
10
what,
years.
what is it that you say? They typically have like a little irritation in
There's a
that
little
area or something?
irritation in the area,
Uh,
So like I had one person who said their throat was tingling. And I said, that's a very unusual symptom. And I said, anything happened? Like, oh yeah, history of cancer in the area.
oh
And
wow.
we had the cancer removed, everything's done, but there's like some scar tissue. Like, oh, okay. So like, but he wouldn't have known, right? And I didn't know he had anything with his throat until he mentioned it. So again, that's very anecdotal, but I think the reason why I bring it up is that it's really about inflammation. So I think when you take NAD, the reason why we age is due to inflammation, right? So one, we probably can decrease cellular aging through NAD, right? Increasing the body's capacity to have more energy, ATP. There's all these other enzymes that are also good for the body, which are, sirtuins and PARPs, all these things help regulate DNA repair. So when we think about how NAD works in the body, it's really about, does this repair DNA? Does this decrease inflammation? Are my cells more optimized? Do they have more energy? And are all the things that are in my body toxic, helping getting removed, right? I mean, anecdotally, again, some people say they report weight loss, right? And so
Hmm.
that's interesting. Why are you getting weight loss? Well, if the body's more optimized with energy or has more energy because maybe the person's not eating enough, you can technically produce NAD from having a whole balance, diet and things like that. But it's hard. Not
Right.
everyone can cook their own meals, and we travel a lot, or you're eating late at night, and you might have gluten and all these other things that's not conducive to NAD production. So I think a really big interesting space that we're going to see is a lot of people are on GLP-1s, right?
Right.
People like Ozempic and semaglutide and all that. I think what we're going to see is huge synergy between GLPs and NAD, because GLPs are working on people's metabolism, right? And then also there's some interesting work in the longevity space where people are taking low dose GLPs.
Mm.
So combination of low dose GLP plus NAD could really be a great anti-aging mechanism. Or people who are on GLPs because they had, that criteria, they might be obese, things like that. They already have metabolic dysfunction. And so NAD being reintroduced into the body to help restore metabolic function is a great combo. So I think that's kind of where this whole space of functional medicine is really going to tie in, right? Because these are not things that doctors were trained in traditionally, right?
Right.
Peptides and GLPs new in the space. Forget about even NAD and all the IV vitamins. That's not taught in med school either. Maybe now in the curriculum now, but most of the doctors who are out in the field and have been practicing for a long time, I mean, nutrition, we didn't really learn it directly in med school. I learned it outside of school, right?
Wow.
And
How,
then
how much nutrition did you get in med school?
you get like 1 week, right?
1 week.
Yeah, right. And
Wow.
now, functional medicine is massive, but that's probably one of the reasons why I travel around the world so much. I mean, I'm pretty international, at least a third, if not more, of my time, either doing lectures, learning,
That's
meeting
awesome.
colleagues, and you want to get that very world perspective too,
Yeah.
right? Just to see what's going on,
What else is out there,
Yeah,
right?
what else is out there? I mean, I think America has one of the best systems, right? But there's still things that are quite novel in the world.
Yeah. 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 So, as a NAD expert, where do you get your NAD from?
We get it here sourced here in America, but I would say
Because
the
I,
raw.
I can only imagine you got the best quality
Yeah,
NAD.
that's a great question because, while it's produced here in America, the raw compound is made in Japan.
Oh, it is.
Yeah,
Okay.
and so it's quite interesting because there is a difference. And so some people when they try one product or another, they just notice that it's stronger. And I'd say there could be a few reasons why it's like that, but I think one of the components is that it has a high stability on the shelf life,
Okay.
right? So if it says 500 milligrams of NAD, it probably is actually, 99% 500 milligrams. Whereas some other companies out there, the purity and the potency go down. So even though it says 500 milligrams, it might be only 300 milligrams. So it's kind of the analogy I would give down, give that as like watered down Botox, right?
Right.
Someone might see their plastic surgeon and the Botox lasts 3 to 4 months, but then somebody might see a different person who is not their normal plastic surgeon and they said, oh, my Botox wore off in a month. 2 months.
Yeah.
And so that's the same concept, but I think it's more so it's not like the manufacturer is doing it on purpose. It's just it's sourcing. And you can get NAD sourcing from, China and whatever. And, things like that might have heavy metals and
Right.
things like that.
And a lot of those raw APIs come either from India or China a lot of the times, right?
Exactly.
So let me ask you this. So NAD, it's I've learned that it's temperature sensitive,
Hmm.
right? I'm talking about IV NAD. Is there a difference between the quality if you're getting NAD that's been sitting out of the cold environment?
I mean, I think obviously that's sort of more of a what is the preparation and storage of it? I mean, probably it won't be as effective, right? But I
Right.
mean, they do stabilization studies, and sometimes, even with, what's on the label, they say store it, but then they also do like max studies, right? Can you actually still administer this if it was sitting on a table for a week? And so some studies say you can, right? At least these are in-house
Right.
quantification studies from the compounding pharmacies. So I think there's always going to be a little bit of that role. I think the preparation of the NAD, the sourcing, I mean, some of this is what we call trade secret too, right? Certain pharmacies don't even release how they produce the NAD IV because part of the secret sauce might be this one or two things that they do to pre-treat
Right.
it, right?
Okay.
And that's a lot of the like what I would call the regenerative medicine world too, right?
Yeah.
There's a lot of trade secret. Once you tell everyone, it's like, oh, well, then I'm going to clone the cell that way too, right?
Right.
So
Is there a difference between buying your NAD already in solution versus the Lifelies product?
it's interesting. I actually prefer it when it's already mixed as a liquid. Could lyophilize be a better way to do it because it's less temperature sensitive and whatnot? I mean, I'm open to both. For me, the way that our compounder makes it, it's always in a liquid, but
Right.
it could be lyophilized.
I've always wondered that. Is the potency still the
We could
same
we could
between
do a
both?
study for you. I mean, I think at the end of the day, it's like as long as the patient gets the result, then that's the most important key thing.
Right. Of course.
But I think the hard part now is finding out not only just dosing, like what version of NAD is good for you,
Right.
right? Or what version or what combo stack, right? I think one of the things that you could really dial in is like maybe I take my IV NAD, I do my oral supplementation to go into the cell, my daily maintenance formula, and then I have a subQ injection because I take GLP-1.
Right.
That doesn't sound unreasonable to me because when I look at it, they're all doing different things metabolically. Now,
Right.
it does get interesting in the sense of like, is subQ NAD better than IV? Well, IV is probably going to be stronger, but
It's
not
gonna be a bigger dose too,
right. It's
right?
going to be a
Yeah.
bigger dose, but subQ is not that impractical because when you do a subQ, you can actually do it in the comfort of your home.
Right.
So there's going to be ways that
Yeah,
this
I'm
can
just
get
not gonna
enhanced.
do 1,000 milligrams.
Yeah, no, because
That's
yeah,
not
you
gonna be
put that
fun.
1,000 milligrams, you just feel it, and you're just kind of like regretting that injection that day, right? So,
Yeah,
uh,
yeah. So, all right. So, with NAD, is there any patient that shouldn't get NAD?
I think that's a tough question, in the sense that there's this one early study, it's like, oh, maybe can NAD be bad for people with cancer? It's like, anything that involves cancer, everyone's going to just shut down the door, right? They're going to be like,
Right.
well, if you have cancer, don't do this, don't do that. So, obviously, from a precautionary standpoint, if you have cancer, you should probably most likely they'll say consult your doctor if it's appropriate. And then most doctors say don't do it. I mean, I'm okay with that, right? But is there enough studies to support that any patients with NAD taking NAD will cause more cancer or fuel the cancer? You could argue, well, cancer cells fuel, if NAD is fuel for a normal cell, it could be fuel for a cancer cell. Well, what about a patient with lung cancer? Should they stop breathing oxygen, right? They got this lung cancer, right? And so don't the lungs rely on oxygen? So it's a little bit of that theory, kind of that train of thought. So you could also then argue, well, technically NAD helps with DNA repair and regulation, and it gives the body to fight back and it boosts the immune system. So then you could argue that NAD is good for your immune system. And if you have cancer, maybe it's something that's plausible for you. Again, not medical advice for the audience, but
Right.
things to consider. I always say the answers are in the questions. And I think when you have good questions, that's actually how you create good research studies. NAD in pregnant women. How does NAD affect a baby while growing? That's no one's going to do a study on that, right?
Mm,
No one's going
right.
to do, hey, this group of women were pregnant and this group of
Yeah, I
women
don't
were
think they
pregnant.
would take the risk
There's no,
doing
there's a
it.
risk, right?
Right.
But it could it be either or. But that's where I think like that's why certain things are a little bit more safer, right? If you take more oral supplementation, that makes more sense because your body's going to at least when it's orally taken, it's going to just excrete through the kidneys the excess, right?
Right.
Typically, right? Or some sort of form of metabolism where maybe it gets excreted in the bile and then goes through the gallbladder and then it goes out, through
Yeah.
your waste. So I think I think the supplement space because it's so large and there's so many players, when you're looking for a good supplement, is the research behind it good? Is the founding team like a real founding team and they devoted themselves to the science of it? Because there's a lot of supplements in the space. It's just a marketing team,
Right.
right? They reach out to a manufacturer. They're like, oh, I like these ingredients. Let's manufacture it. Let's sell it. And they kind of pose themselves as
Well, like a white
experts.
labeling
Yeah, it's
game.
a white
Yeah.
labeling game, but like you can tell the supplement companies that are out there that are legit. They're doing lots of revenue because they've been around for a long time.
Right.
Or let's say they're a newer company, but they're more of a startup, but the founding team is passionate about it. That's what you should look for when
Yeah.
you're looking for supplementation.
I agree, especially if you got like a supplement that has like a scientific advisory board,
Right.
reputable doctors, there's some research going behind
Yeah.
it. One of the ones that I was amazed by, and I interviewed one of the main doctors who's on the scientific advisory board is IM8, the
Oh yeah.
David Beckham's
Yep.
product. Like they're putting a lot of science behind it.
Yeah.
They got the Mayo Clinic involved and
Yeah.
everything else. So with NAD, I've heard of like patients that are very ill patients,
hmm
sometimes it's cancer patients, patients with autoimmune issues, like just feeling like crap after doing NAD. Any reason why they would feel like that?
Probably their body's in dysregulation already. Right. And
Okay.
so like they probably don't feel as good in general. And so maybe their body feels that way because it's also like a barometer, right? And so the NAD kind of mentioned the feature of unmasking. And so there's probably unmasking of some other symptoms that are happening in them. But it's hard. It's like even cancer is so specific. Is it very serious cancer like pancreatic cancer? Or is it a type of cancer that might be quote unquote curable, like prostate cancer? I mean, nothing's always curable, but there's a higher chance of survival, right?
Right.
I think it really depends on the type of cancer. It depends on the dose. I think that's also why the whole concept of like which NAD is right for you. And so I think in that game of like I call it the NAD wars, like everyone's like mine's better than this guy and da da da. There's a combination, and so maybe in cancer patients, maybe it's more specific. They might need a different flavor, a different dose.
Right. Are there any particular biomarkers that you would want to keep a close eye on for patients getting NAD treatments?
So that's one of our studies that we're going to be producing. It's like part of the longevity world is like, what kind of markers do you use to measure longevity? There's a methylation study made by True Diagnostics, which is interesting, right? And that's kind of measuring like their DNA that gets methylated, and that's a sign of
Mm,
genes turning on, genes turning off. They have also like your biological age. So
right.
those are cool, right? And so I think in the NAD world, even measuring NAD is pretty hard, right? Because it's a pretty complex process. The traditional methods, which are gold standards, are using mass spec, which is a pretty very heavy duty equipment, and just even to prepare the sample, you got to freeze it at -80, things like that. Interestingly, because science and cost of equipment's going down, it's a lot easier to do these things. So I don't think there's one single biomarker that's great. That's your thing for NAD. I think it's going to be a combination. Like there's another test coming out. It's called a company called MeScreen. It's measuring your mitochondrial function. I would think that's an amazing test to do.
Right.
And everyone should do a MeScreen test because you want to know your baseline mitochondrial function. Because that's basically telling me, how does your body produce energy? And is this energy going to be effective? And then is there something dysfunctional in my oxidative state, meaning like I have a lot of stress in my body?
Right.
And so I think because we now have the science to measure these things, it really gives people a lot of insight and control on how they want to manage their health.
What about VO2 max?
Yeah, VO2 max is good. I mean, I think these are all the new what I call like health markers, right? You go to your doctor's office, you get your blood pressure measured, they weigh you.
Right.
Maybe they might even do a body composition. Some places have DEXA scan, but like I think the more advanced places are going to have things like a VO2 max. They might do grip strength, right? Grip
Right.
strength has been correlated to longevity. So I think all of it interplays, and then everyone's different, right, for what their goals are. If somebody's more sedentary, maybe the VO2 max isn't as interesting for them.
Right.
People who are athletic, maybe they definitely want it. I've even had a device where I was doing hypoxic training, right? Convincing my body that it had lower oxygen to then increase my body's production of red blood cells. Those are
Yeah.
the things that I think are next gen. Where like,
Yeah. There's some technologies out there.
yeah, there's
Dr.
some,
Parita does it out
yeah,
of
yeah,
his office. Yeah.
exactly. Yeah,
Yeah.
there's a lot of cool things that are out there. Like, it's not, we see a lot of wellness biohacking places, whatever you want to call them. And a lot of them just focus on, and these are all great things like cryo, red light therapy, hyperbarics, and then and then IVs, right? But then really getting into the nuance of like I said, hypoxic training,
Right.
maybe ozone IV therapy. And some of these things are more complicated, right? Because even the people who are doing plasmapheresis, which is kind of like an oil change for your
Yeah.
body, but those are really good for certain people, right? Like,
EBO2.
yeah, because let's say you
Yeah.
had long hauler COVID, and
Yeah.
you're trying to pull out this antigen complex that's causing this sickness in you or whatever it is, right? Now there's even things like microplastics.
Yeah.
And so the microplastics in your bodies now are, it's not a minimal amount, it's a large amount. I
Wow.
think the studies are we consume about one credit card size of plastic daily, like a
That's
day,
crazy. Wow.
right? So I think there's room for so much. So I think longevity is not going to be a quote unquote. I always think it's a misnomer that term. It's not about like living to 120, 130. I'm more on the health span side.
Healthspan. Yeah.
Maybe I get to 100, 111. That's a nice number, and
Yeah.
then that's it, right? And then you just boop. That's
Quality of life is
yeah,
important, man. You don't want to live 150 years
yeah,
and all
uh,
of a sudden you're a vegetable for a
yeah.
hundred of those.
Yeah, if you're like 150, like, but from 100 to 50 years, you're bedbound.
Yeah,
Just leave me at
I'm good,
100.
right?
Yeah, I'm good at 100. That's I want to live to 99 and done.
Yeah. Now, Doc, there was I no longer take it. I probably should order it again, and I'm trying to remember what the name is. But anytime I was taking the NAD, at that point in time, it was a powder that I
Uh,
would take. It
what to
was like
help the NAD symptoms?
supposedly it helped with the absorption of it. It was like three
Oh,
letters. There's an abbreviation for it. I want
hmm.
to say TNP
Oh,
or
it's
something.
maybe it's trimethylfolate.
That's
TM,
it.
yeah.
Yeah.
It's basically it kind of helps with some of the side effects of it because NAD can consume a lot of methyl groups, right?
Okay.
And so taking this supplement kind of helps with some of the side effects. Another thing that people take are these like beef liver pills because it also donates a lot of methyl groups as well.
Does that really work? Is it?
Yeah,
Does it help with
I've
absorption? Do you know?
I mean, it probably helps with efficiency.
Okay.
I think the absorption question is like if you're getting IV NAD, it's absorbed, right?
Right.
But then it's more about the utilization, kind of that chemical reaction that's in
Right.
your body. And so again, back to sort of like how does our body's metabolism work? That's kind of the key thing. And so I think a large part of like, the debate in the science world, clinical world, the online social media world, it's like you have a lot of people kind of just like having hypotheses, but then you got to test it,
Yeah.
right? And so it's very easy to be like a keyboard warrior or like even like a article warrior. And I read this, but that mouse study might not apply to humans,
Right.
right?
Right.
So I think that's why, for me at least, that's why I became so mission driven to do university based research, studying the NAD molecule, understanding metabolism, talking to colleagues, traveling around the world. Like, I have a lot of other things I could do with my free time, but I choose to do this
Right.
because like I think it's that important,
Oh,
you
and
know?
you're passionate about
Yeah.
it too. So with NAD, man, a lot of the hedge fund guys, they're calling this the brain reboot. What is it that NAD's doing in the body that's making people sharp as a tack?
I think it's basically people who are depleted of energy, they probably have that fog lift, right? When the NAD gets into their brain. And a large part of it, there's some interesting early studies too. It's like, could NAD help slow down dementia? Or can NAD help clear out the receptors that are causing early Alzheimer's? So I think that's probably what it's touching upon. It's the same reason why some people also would take NADH. Now, I think from a cognitive standpoint, NADH is more effective for clearing out that fogginess and giving people that mental sharpness. But I think
Right.
that's kind of where the idea of combining NADH, NAD plus into like combo like therapy is where it's going to go. And that's why I think the field now is no longer just about I take NAD. That's pretty generic in terms of like terminology, right? That's sort of like I drive my car.
Right.
But like there's trucks, there's motorbikes, there's
Right.
sports cars, stuff, electric vehicles. So it's the same classification. If you're on NAD therapy, it's going to go to what type of NAD therapy are you on? What route is it? IV, oral, subQ, da da da. So I think that's kind of the key part is really understanding NAD is not just actually this one molecule anymore. It's different molecules and derivatives and precursors and different routes of administration. And so that we see that in medicine, clinical medicine has different routes of antibiotics. And we came up with all these different antibiotics because certain bacteria don't respond to other antibiotics. And then you can have oral antibiotics, IV antibiotics, injectable antibiotics,
Right.
antibiotics in a spray. So all these things kind of contribute to like, and obviously in that infectious disease medicine has been around forever. And so now the concept of like cellular medicine, is really big now because cellular medicine was probably considered more like bench work, like laboratory stuff. But I think it is coming mainstream because in the era of functional medicine, testing is so important. And the testing is not just your generic thing that you might go to a typical lab core request, which is good. They do the basic exams, or not even, they have some advanced stuff, right? But in the functional medicine world, we're seeing so many more novel things that are coming from private companies.
Right. Right. With NAD, you start hearing a lot of these stories from people. Oh, I did electromagnetic field
Hmm.
therapy, and I did my NAD 500 milligram drip in 30 minutes. Or oh, I did a CBD IV drip,
Hmm.
and I was able to do my NAD after within 30 minutes. Or there's just I did a red light bed, and I was able to do my
Right.
NAD much quicker without any kind of.
Hmm.
Have you heard of any of these things happening?
I think I hear everything, right? So, I mean, look, if someone can tolerate it and it doesn't cause them problem, that's good. I mean, from a red light bed perspective, I know like people methylene blue IV's gotten popular these days,
Yeah.
but like, red light therapy apparently like helps with a lot of that mitochondria function with methylene blue. So those are things I think are interesting, what I call biostacking,
Do you
right?
do that stuff, the methylene blue?
Yeah, I
Yeah.
do IV methylene blue. It's quite
Nice.
I think methylene blue and IV NAD kind of have a tendency to synergize.
Nice.
And so and there's some controversy about is methylene blue IV good for you versus is it bad for you? And da, da, da. I mean, there's a lot of debate on. I
What
mean,
are your thoughts about the
I
methylene blue?
think I like it, right? I mean, do you want to do it in high doses over time, many times? I mean, a little unsure on that. I mean, I'm very confident on the IV NAD or oral supplementations and precursors. I think those are absolutely safe. And I think they're consistent that you can do because your body already has a mechanism that it uses to
Right.
produce it or salvage pathway it or endogenously like absorb it, right? So I think that's something that's probably, and I think we're like, and why we would think about why are we in an era where this is so important and we need more things like IV NAD. I think we're just in a much more difficult environment, right? Our food is highly processed, and so we're getting a lot of gut inflammation. So gut inflammation is a massive thing that's causing medical diseases. We have massive hormone dysregulation, endocrine dysfunction, right? All the plastics and synthetic stuff that we're being exposed to, even in our clothing, right? With the
Right.
clothing, there's been a lot of controversy in some of the sports clothing and athleisure wear leaching into the skin and then you're absorbing it. So I think we're in an era where our body is so naturally depleted of energy because we're constantly fighting our environment. And
Right.
that's toxins, exposures, low quality food, highly processed food, and then, just the chemicals around us.
Yeah. Yeah. What would be your top three things to detoxify the body based off of a lot of these environmental toxins,
Yeah.
ultra processed foods, and all that other stuff?
I mean, obviously, a great diet can help detox the body, right? So
Agreed.
having whole food diet is really good. People doing a lot of sweat saunas and things like that. You can sweat out the toxins. There's some good supplements out there that also help free up toxins from your body, like heavy metals and binders. That's a good one while you're doing some of these external things like sauna. And then for me, obviously, an interventional standpoint, I'm very strong on how I think IV NAD can help the body, and that helps
Absolutely.
detox. So it's combination, right? Lifestyle, and then sort of the things that are very intervention based, like supplements and sauna, and then medical based, right? Medical detoxification.
Yeah, yeah. I like to break everything into three categories, man. I've been like really sticking to it, where it's like prevention,
Mm,
early detection, and treatment
yep.
intervention, and making sure that you understand what you're doing in all three of those pillars.
Yep.
Um, so let's switch gears a little bit
Hmm.
here. You're now here in Miami. You got some cool stuff in the pipeline. I don't know how much you're willing to talk about it, but it's around the stem cells and
Hmm.
the regenerative medicine.
Sure.
So let's talk about it, man, because this is like
Yeah.
the future of a
Yeah.
lot of stuff we're
The
talking about.
future of medicine really will be regenerative, right?
Right.
Obviously, as you mentioned, stem cells essentially became legalized in Florida as of July 1st, right?
Yeah.
Which is pretty incredible. I think, I would rather have an openness around the conversation because what you don't want is have people just fly to Mexico. Nothing wrong with that, too, by the way. There's some great docs and institutions out there that are doing it. But, you want people who are going to a safe place. And so when you have it where it's more popular, you can do things like do a stem cell therapy in the US. There's just a bit of a higher quality of standard, right?
Yeah. What
Right.
why are people going to Mexico, the Cayman Islands, and all of these other countries to go get these stem
Right.
cell procedures? I mean, you hear Tony Robbins talk
Yeah.
about it. You hear all of these like
Yeah.
very high profile individuals.
Well, I think in the earlier days, it was, well, there's many reasons, right? One, it might be cost, right? It just might be cheaper to do it in Mexico, right? Just in general. The second aspect is when you think about like the evolution of stem cells and how it kind of came to the scene, the FDA regulates the stem cell like a drug, right? There's certain criteria in which if you do this, like clone the stem cell, if it's considered more than minimal manipulation, XYZ. So there's all these criteria. If you do an additive, FDA is like, you're making a drug. But that's
Mm,
kind of true, right? It's a physiological drug. If a stem cell can heal your torn meniscus, I mean, that's a therapeutic benefit, right?
of
Which
course.
has which is pretty much like drug like or acts like a drug. And so when we take these things into consideration, like we're very much research based. So there are IRB studies that are, under FDA, they know about the studies that are happening. And so you want to do these IRB FDA based type of studies because you're really studying it. So some of the things from a stem cell research perspective that are very popular under IRB studies, one, long hauler COVID, right? There's not like this cure for long hauler COVID, and we're discovering more and more how long hauler COVID has even more problems. Two, autoimmunity. Autoimmunity coming from vast majority of problems, right? Leaky gut's probably a big source of autoimmunity, and then environmental toxins. Three, neurodegenerative, Alzheimer's, dementia, things that are very hard to treat. There's not like a drug or a pill that says I'm reversing your Alzheimer's, reversing your dementia. And then the fourth, musculoskeletal orthopedics, right? You can either do surgery, like arthroscopies or replacements, or maybe stem cell therapy, right? Which can actually heal something that otherwise wouldn't have been able to heal, or the person wasn't a good surgical candidate.
Right.
So if we kind of take a look at the whole of what's happening in the stem cell space, like what I'm very a big fan of is mesenchymal stem cells. So you have mesenchymal stem cells, hematopoietic stem cells. And you kind of have all these little exotic ones that you're hearing about also on Instagram and social media. My primarily focus on mesenchymal stem cells and what I call autologous, your own DNA. So your own DNA, in my opinion, has all the blueprint and instructions to help heal your body. That's actually how we survive. When if you're a young child and you have an injury, notice how young kids actually bounce back faster, right?
Right.
If a young kid hits its head or his or her head, the recovery is much better than a 90-year-old grandma grandpa because of the elasticity and also the healing capacity of the brain and the tissue. And one aspect is it's stem cells, right? There's a higher quantity of stem cells. There's more robust. As we age, or we have stem cell exhaustion, right? We don't have as much stem cells. We're not producing it as much. It's not dividing as much. So in the terms of like where stem cell research is now, you can actually clone your stem cells legally in the US, right, under these IRB approved studies, and then administer it to you. But one of the key things that's very important, like let's say mesenchymal stem cell, which is very, very potent, it can actually turn into other different types of tissue, like connective tissue, muscle, right? Things like that,
Mm,
organ tissue, right? So stem cells, you can give them in several routes, but one is IV, one is a direct injection. Let's say we're doing a joint. So let's just take a mesenchymal stem cell and you're cloning that stem cell, right? There's even aspects to that. Again, kind of like how people use the generic term NAD. A stem cell is not just a stem cell. How you clone the stem cell is very important. So, for example, when someone says I'm doing stem cell therapy, that actually doesn't really mean a whole lot. Well, what kind of stem cells?
right.
Okay, is it autologous or allogenic? So, autologous means auto, yourself. Allogenic means another one's. And so, typically, most people are doing allogenic stem cells. It's a donor stem cell source. Nothing wrong with that. There are donor banks in even these research studies, but if you can do autologous, the best thing is it's your own DNA and you're less likely to have a reaction like a graft versus host, right? And that happens, right? But when you do autologous, your own DNA, you can get cell quantities in the hundreds of millions. And so, why is that important? When someone's doing a stem cell dose and it's 20 million, 40 million stem cells, that's not really, in my opinion, a high dose. Therapeutic high doses are 200 million and above. That's a
Wow.
10 factor increase. So, you kind of look at it, you're getting 10x the dose that is mostly available around the world.
And where are you pulling these from? Like fat tissue, whole
Right.
blood,
So typically you
bone?
can get mesenchymal stem cells from fat tissue.
Okay.
And it's not that you're using the fat itself. The fat's a nice, soft, cushiony place for these mesenchymal stem cells to hang out.
Okay.
And so a stem cell bank gets created. And this stem cell bank is basically your permanent archive. Obviously, it's all registered. These are things that, if the FDA wants to look at it, they have an archive bank, right? Then you pull from this master bank and you can clone this stem cell out. But you clone out to 200 million cells.
Wow.
And that's not, and then there's another layer. So now you've solved the layer of I have enough cells. A lot of people say stem cells get stuck in the lungs. That's a true statement too, but partially true. When you culture stem cells in a typical lab grown medium, so kind of very basic stuff that, is very standard in the industry, stem cells have a tendency to get very big and sticky. It's like this polysaccharide material, which is like a carbohydrate. And so when you get these cells that are big and sticky, they get trapped in the lungs. Now, you're not going to die or anything, but basically the localized treatment becomes in the lungs. But if you have Alzheimer's, dementia, Parkinson's, et cetera, whatever condition that falls under the neurodegenerative condition, you want it to get past the lungs into the blood brain barrier. And so it's going to be very important that the stem cells are very small and not sticky. That's possible. When you actually know how to clone stem cells in a very particular way, know how the science works, the stem cells can replicate in a small, compact way, which also allows you to get them to that 200 million limit because growing 200 million cells that are big and sticky requires a very large amount of space. But growing stem cells that have a high integrity of the cell, the size, and the quantity is actually small and doesn't take as much space.
Can those large and sticky ones that you're talking about create a clot or anything?
It's not really going to create a clot because you're also going to have a filter
Okay.
when you actually give it as an infusion. It's just they're just not as effective, right?
Right.
And so this is kind of like the nuance of the stem cell world, just like there's a nuance of the NAD world. So in the ideal world, which is kind of basically we're about here now, we can clone stem cells in the 200 million range. They're small, they're not sticky. The genetic capacity of it is your own DNA. The quality of the stem cell throughout the cloning process has high integrity, meaning there's no mutations, there's no things that could cause anything bad in your body. That's where we're at. That's why I think stem cell therapy will become more mainstream, hopefully in the next 5, 10 years. I think also being in Florida with the regulatory being very supportive of like, hey, you can get stem cell therapy now. We're going to learn a lot. And so
Right.
that's why, like I said, research first. You always want to study it, make sure it's right for you. But, I've seen a lot of really good outcome.
Yeah, that's amazing, man. And I keep on hearing from a lot of people that were flying out of the country to get the stem cells where they just do it as they call it almost like their birthday shot. They go
Yeah,
at least
it's a good
minimum
idea.
once a year, and they're doing it more for age management.
Yeah.
To help prevent disease, have good
Mhm.
vitality, have vigor, etc. What's your recommendation for someone who's potentially like listening to the podcast and considering, man, this stem cell stuff sounds pretty unique,
Right.
you know?
I like the idea of doing it on your birthday, right? I think the old school way of how people viewed health. I'm gonna do my annual physical.
Right.
Honestly, like that's so outdated. Like, what is your doctor gonna do when he sees you one time a year? Like this is like a whole, this is a lifestyle, right? I mean, maybe
Yeah.
he can do something, right? I'm not knocking it by all means, obviously I'm a physician myself, but like I view it more as like the relationship you have with your doctors, the relationship you have with your body. I think if you're doing even standard lab workup every 6 months at a minimum.
Right.
So from a stem cell therapy perspective, you could probably argue twice a year. Once a year is still good, right? Like, because if your body's like, let's say your baseline, you're at 10 out of 10, right? And then at the end of the year, you're a 7 out of 10. Well, look, having that stem cells to boost you back to 10 out of 10 kind of just always resets that body.
Yeah. Yeah.
Is there an ideal cadence? I think twice a year is really awesome.
You know, Dr. D down in
Yeah,
Miami at
yeah,
Biohacks,
yeah.
well, he brought one thing up, and I was like, man, that's a really good idea. He says, we need to create a functional medicine calendar
Yeah.
that people follow. It's like, hey, this time of the year, you're going to be doing this type of testing, doing this. This time of the year, you do your stem cells. This time of the year, you're doing your detoxification protocol, etc. So I think that's something that in the functional medicine world should like someone should actually come up with that.
Yeah, I think it comes down to like the openness, and then obviously, unfortunately, a lot of this stuff's not covered by insurance.
No, it's not.
But I
Right.
think that's if the insurance world could open up and like, hey, if we actually did this functional testing, we wouldn't have as many people on diabetes.
Right.
We wouldn't have these people with complication with heart disease and things like that. But I think, what's happening in this space though is the cost is being driven down for these tests, right? And so when we have these lower costs, we can actually do these things on a base level. But, again, it's sort of like, how do you want to allocate your time, money, and resource? Maybe you might not go out as much and let's say, for example, go drinking, right?
Right.
Because drinking is like, it's fun, but maybe just it's not really cost effective, right?
Right.
And maybe it's not also benefit for your health. So I think if we reallocate how we spend our money, I think it's not unreasonable to put $1,000 aside over the course of a year for your health. You get quite a good amount of testing done,
Yeah.
and you pull that from your entertainment budget.
Absolutely. So, Doc, there's a lot of hype on the anti-aging world, and there's all kinds of products.
Mhm.
You walk the floor of some of these conferences, and you're like, "What the heck is this?" What is that one thing that you keep on seeing, or you're just like, "People, please stop."
Oh, I don't know. I'm probably not even looking at it because I'm usually at the conferences, meeting up with friends and colleagues. I don't know. I'm very open-minded to stuff, so I
Yeah.
never want to like shut one down. Like it's like maybe I just don't know enough.
Yeah.
I think,
Yeah.
and that's more the science mind. Like you're inquisitive, and I don't want to pretend like I know everything. So I'm very kind of like, oh, that's interesting.
What's your thought about like frequency medicine? Like
It's interesting.
microcurrent.
Yeah, I've seen that. I mean,
Bioquantum.
look, there's definitely some interesting frequency products that I think are great, and then you have the product you're like, this thing probably doesn't work,
Yeah. Yeah.
right?
Yeah.
So I think frequency medicine could be that territory where people are like, I don't know if I believe this, or
Right.
people are skeptical. Because then I've seen like they're like, okay, we programmed the frequency of XYZ into this. I'm like, how did you get that signature pattern? Oh, we just have it. From
Yeah.
what? Oh,
But, like, they don't talk too much about it. No, I'll tell you Dr. Willix, who was the heart
right.
surgeon, my mentor, and even Dr. Davis, they're really big into frequency
Yeah.
medicine, and I've noticed that with the guys, like, in the cardiology world,
Yeah.
and, I've been, like, really kinda looking into it, it's just, man, it kinda makes sense, but then it just takes you into, like, this whole
Yeah.
realm and a whole different
Yeah.
universe,
It's very quantum, right?
Yeah,
And so
very
like that
quantum.
fourth dimension of
Yeah.
living. But I mean, I get it. Technically, we're all water and carbon atoms and molecules.
Yeah,
So
see, that's the thing, so all of a sudden
yeah,
they tell me, "Well, you're really not here."
yeah,
You're not I'm just
yeah,
like, "Alright, come on, man.
yeah.
Let's have a regular conversation."
I mean, look, I mean, there is things like harmonic frequency and vibration,
Of
right?
course.
And so if your body's in resonance, which is kind of like a large part of what they talk about, it could make sense that that might like decrease inflammation, or that could be a reason why the cells absorb, more molecules or things like that. So I'm not against it. I just
Right.
think I don't know enough to understand it. But some people swear by it. Like there's
Yeah.
people who are like, oh, I did this frequency thing and then all my aches and pain went away, or XYZ.
Yeah.
Okay.
Of course. Of course.
It's definitely one of the more non-mainstream stuff, but I kind of think it's like, it's like the power of prayer, right?
Yeah.
And so people who are very do meditative stuff and things like that, there must be some sort of frequency of that too, right? Because meditation helps people. I think there's a lot of interesting work where people kind of like people who meditate and think they're going to get better actually get better, but people who think their health is negative and they think they're going to die, they end up getting sicker, right?
Yeah.
I think there was a cancer study on that, right?
Yeah.
People who thought they were going to survive cancer actually do survive. The people who they're like, I'm not going to survive, they have a lower survival rate,
Yeah. I
right?
I actually I believe a lot of that. I believe a lot of that. Dr. Holland, right now there's a huge movement going on, the MAHA movement,
Hmm.
Make America Healthy Again. RFK Jr. is leading the way. Um, what are your thoughts about this movement?
I mean, look, I think he's done a lot of good so far. He removed a lot of the artificial dyes and colors in our food. He happens to be a very pro, supplement IV person. He's very into peptides. So I think what he's doing is good. He's Everyone's gonna have something controversial about them. I know there's gonna be people saying, "Oh, but he did this and that."
Right.
It's like, yeah, there's everyone's on that spectrum. But I think I don't even can't even think before when him, who else actually put so much energy and effort into actually making health, making us try to focus more on our health,
Agreed.
And so I think with that whole Maha movement, like I think there's a lot more good happening than bad. And
Yeah.
I think because the awareness is about nutrition and all of these other things, that's a positive thing. And he actually cares about our food supply, which, if we could actually just have great, clean, healthy food, I think half of our problems would go away.
Yeah, I agree. So, Doc, we're gonna have a little bit of fun right now.
Okay.
All right. I'm gonna say a name of a biohacker,
Hmm.
and you're just gonna say the first thing that comes to mind.
I see.
All right.
Okay.
Um, Gary Brecka.
Um, I want to say 10x because that's what he's affiliated with.
Okay.
I don't know
Okay.
if he is anymore.
Joe Dispenza.
Definitely spiritual,
Yeah. Dave Asprey.
biohacker,
Ben Greenfield.
fitness,
Brian Johnson.
experimenter.
Peter Artia.
He's kind of like he's definitely longevity at pharma. So, like, calls it like health. Can't remember something like 3.0, med 3.0.
Yeah. Yeah. Awesome. Awesome. So, next thing we're gonna do. So I bought these cool cards here
Hmm.
from one of my favorite podcasters, The Diary of a CEO.
Oh, okay. Yeah.
That's Stephen Bartlett.
Yeah.
So he came up with these. So we're gonna open it up. Actually, I'll let you open it up,
Okay.
and you're gonna grab two cards out of there, and you're gonna answer the question.
I'm going to answer the question.
Yeah.
Okay.
So you grab two cards. You can shuffle them up or whatever. You'll read the question and then answer it. He's got a killer podcast, by the way.
Yeah, no,
Yeah.
I've listened. It's really good. Wait a minute. Some of these are longer questions, right? All
Oh,
right, let's
no.
pull two. One, two. What makes you angry about society? And other question, what would you do if you absolutely weren't afraid? Hmm. What makes me angry about society? I think I think we're in a society where there's so much possibility, but there's a large amount of people who focus on the negative stuff. And I think if you actually put your energy into the more positive things, you'll get more done. And so kind of like we're in an era where people are, I don't want to say they're not as resilient, but it kind of is how I feel. Like everyone wants to complain about something. How about people just focus on doing stuff,
Right.
right? Complaining is not going to get you anywhere. You got to actually just take action. So I would say like that's kind of like what I'm noticing is that the resilience for people is like really low.
You're noticing that too with a lot of the younger generation.
Yeah, combo.
Yeah.
I mean, definitely when I grew up, there's a ton of stuff that happened to like me as a kid. I'm like, that was normal. Now it's like drama and
Right.
people want to talk about it on their podcasts and blow people up on IG. Like, guys, just be understanding and
Right.
tolerant or whatever you want to call it. Yeah.
Agreed.
Um, what would you do if you absolutely weren't afraid? I don't know. I think like I have a friend who's like learning how to skydive. I don't know if I would do that in my free time, but I'd probably like do stuff like that. I don't know. I think I have such a high sense of responsibility. I'm like, well, what if I die? It's like I'm not even concerned about dying. I'm like, what about all the people who like rely on me and all the things that we're doing?
Yeah.
I kind of feel like more like that would hold that's what holds me back.
Or
Right?
injuries and stuff too.
Yeah, or
Man.
injuries. I don't want to be a patient.
Yeah.
I already know what that's
Yeah.
like.
Yeah.
Because I treat a lot of people. So I'm like, I got a perfectly great body. Why am I jumping out of a perfectly functioning
Right.
plane? So
I've had friends that's like, hey, let's go skydiving. I says, I risked my life for about 12 years in the fire department.
yeah,
After I retired from there, there's no more risk.
yeah,
I'm not jumping out of a
I
perfectly fine
agree.
airplane.
That and like heli skiing and all these things. Like I think if I was, in a different age where it didn't matter. I think when you get older and have more responsibilities, there's that bigger mission, and then if you have a family, of course, right?
Yeah,
You don't, I think the stakes are different.
I agree, of course. So, Doc, If there's somebody out there right now, man, that is listening or viewing this podcast and they can really resonate with today's message, and there's one thing that you can leave them off with, what is it?
I think it's really about focusing on your priorities. And like a lot of people don't think health is a priority for them because they're overall okay. Or let's say there is something they're dealing with their health. It's just focus and consistency. It's so easy to say it, but it's actually really takes a lot of energy. And so if you can kind of create this routine around focus and consistency, that's big. And I kind of didn't even talk about it too much with during our session now, but like the mindset of longevity is truly a mindset. It's just like how an athlete has a certain mindset to like win or perform. There's a saying like championships are scheduled, right? You don't just win a championship because you play, good football or soccer, et cetera. You schedule that, and
Right.
it's the discipline, it's the mindset, it's the consistency. So I think the biggest thing is like if you've been thinking about doing something for your health, now's your moment to just like write it down and make it happen, and just consistently look at it. Even if you don't do anything, just looking at what you've like written down is very important. So I think also using pen to paper is really helpful.
I love that. Amazing. And Doc, if people want to find you, where do they find you?
Probably more on social is pretty easy. I'm at Dr. Holland, so DrHalland. So it's spelled like the country, except with an A, on IG and TikTok. Pretty much on all social platforms, it's that. And we love getting questions. You can even find us on our website and send stuff. So happy to connect. And we're just producing more and more information out there. So once we release a lot of the research, I think people want to know a little bit more.
Amazing. Doc, we'll have all those links down below.
Yep,
And this was very informative.
awesome.
One thing that you're doing here, you are changing the course of medicine. It's one thing to be a physician, it's another thing to be a physician and doing what you're doing. So I want to thank you for that. And thank you for coming on the podcast.
Great. Thanks, Sam, for having me here. I really
Amazing.
appreciate it.
Yeah. Guys, you heard Doc. He said it: longevity, health, wellness. It's a mindset. Write it down, right? It's just like anything else that you want to accomplish in life. You have to plan it. It just doesn't happen. You're not just winning the lottery here. You have to actually put in the work to do it. We talked about a lot of different things here, a lot of things that are being researched, a lot of new type of technology modalities that are happening. Guys, make sure you take this podcast, share it with your friends, with your family. Make sure you subscribe, follow Dr. Holland. You have the links all down below. All right. And we'll see you for the next one.